Right. I see we're at 1 o'clock, so we'll go ahead and get started. Good afternoon, everyone. Thank you so much for attending Mental Health America's Policy Institute, which is funded by Kaiser Permanente. I am Caren Howard, Mental Health America's Senior Director of Policy and Advocacy. I will help with facilitating today's program, and I'd like to just extend a warm welcome to everyone who's here in person and who's virtual with us online, and just lead with a little data point about why we think social drivers of mental health are so important during this time and why there's a sense of urgency for MHA to help advocate in this space. MHA's largest program is an online screening program. 15,000 people visit the website a day to take a screening. And in 2023, 46% of people taking screenings on our website reported loneliness or isolation. And screeners who identified as more than one race were most likely to select loneliness or isolation, followed by screeners who identified as Hispanic or Latino and Black or African American. At this time, I'd like to introduce our wonderful CEO, Schroeder Stribling, for a welcome message, and she'll be followed by Simon Borger.
Thank you, Caren, and welcome everyone. It is just wonderful to be together with all of you advocates, supporters, and allies and friends here today at our 2024 Mental Health America Policy Institute. I want to start by thanking our sponsor, Kaiser Permanente, for your generous support of today's proceedings. Because of this support, we are able to gather for a critical conversation on the social drivers of mental health and to focus our ambitions on strategically crafting public policy to advance community solutions and improve mental health outcomes for all, most especially for those at greatest risk. I would also like to express my gratitude and appreciation to our MHA policy team, Caren Howard, Mary Giliberti, Sydney Daniello, and the rest of the team, both for your work that you do year-round and for organizing this day of really meaningful conversation with leading voices from the field. So today we're focusing on the social drivers of health which constitute the vital conditions for well-being, such as housing, food, and income security. As we all know, unless and until we solve for these deep inequities which exist with regard to basic human needs, we will only be perpetuating our most inhumane and costly social problems and deepening the existing crisis in our collective mental health. For almost 2 decades before joining Mental Health America, I had the privilege of leading N Street Village, a DC-based nonprofit serving women experiencing homelessness. The village provides a continuum of vital services from daytime and night shelter to permanent housing, all with an array of integrated primary and mental health care and a range of holistic and complementary wraparound services. We served mostly women over age 50, mostly African American women, and almost all with a very complex history of poverty, trauma, and/or illness. I want to pause for 1 second and recognize that the CEO of N Street Village is here today. Portia Robertson is here. And I'm so grateful that she has taken over the leadership there. And I hope that you'll get a chance to meet her and maybe even to visit N Street Village while you're here. At N Street Village, we knew the Lady Barbara as a daytime visitor for years before she would even entertain moving into the housing we could provide. She spent her days traversing the neighborhood with a very serious gaze, an oversized coat, and always with a flower pinned to her knit purple hat. Over time, trust and friendship developed, and she joined the community, introducing herself as the Lady Barbara, and ever willing to dispense a little spiritual wisdom. She then moved into our housing and lived at the village for several years before the onset of a terminal illness, and she eventually died peacefully at home, surrounded by her friends and neighbors, myself included. While I am grateful that organizations like Mental Health America affiliates, many in the room, and N Street Village exist to provide the necessary downstream help to millions of Americans in need, the life circumstances and social health issues which drove the Lady Barbara and others to years of living on the street, untreated mental and physical illnesses, and an early death were and are largely preventable. Despite the difficulty and the complexity of the issues we're tackling today, as we kick off this year's Policy Institute and contemplate solutions for the future, I encourage us to approach our discussions with hope. We have an opportunity now to seize this moment of widespread distress, disruption, and innovation to advance mental health from an upstream, whole person health perspective, an opportunity to solve for harmful inequities, to no longer exist in systems which perpetuate illnesses, but instead to thrive in communities which promote health, well-being, and recovery. We have an opportunity to reimagine a future of transformation for good. The history of Mental Health America is a testimony to the power of bold imagination for progress. Our job now is to apply the same audacious spirit of our history to the challenges of 2024. We are deeply grateful for the many partners and allies here today and for all of those on the front lines of reform and transformation. Thank you all again for being here and for the good work you do each day in the service of health equity and justice. You are bringing solutions to life in communities across the country. You are bringing hope and healing within reach to people like my friend, the Lady Barbara. Now I'm honored to introduce Simon Borger, Vice President for Mental Health and Wellness at Kaiser Permanente. Simon is uniquely suited for this role today, helping us to kick off our conversation around social drivers. A licensed psychiatric social worker, Simon has spent 22 years working for Kaiser, where he has been a strong supporter of collaborative care and leveraging integrated care models to better meet the mental health needs of members. Welcome, Simon.
Thank you, Schroeder. It is an honor to be here, and I want to thank all in attendance, both personally and virtually, for your participation and engagement in Mental Health America's 2024 National Policy Institute. In the words of Dr. Satcher, the 16th U.S. Surgeon General, there is no health without mental health. And a 2022 report from the Satcher Health Leadership Institute titled "The Economic Burden of Mental Health Inequities in the United States" reports health equity requires not only tailored solutions to the unique problems we face, but also requires innovative approaches and cross-sector collaboration to make certain that those solutions are indeed equitable and sustainable. That in part is why we are here today. We are also here because policy matters, and good policy will help drive better, more equitable mental health outcomes. I'm pleased to help kick off this annual event that will highlight the importance of examining the social drivers of mental health and how they relate to the current state of mental health outcomes in the United States. During today's event, we will discuss programmatic models and policies that are helping people with their mental health and social related needs, we will also note the importance of gaining the support of elected officials and policymakers to help make change happen. As Schroeder mentioned in my introduction, I am a social worker by training. I'm an LCSW in California, right on. And I spent the first 10 years of my so far 24 years, it's 24 years now, KP journey, providing direct clinical care to children, adolescents, families, and adults in one of our outpatient clinics in Southern California. The social worker lens through which I tend to see mental health and substance use disorder care necessitates a consideration of what happens outside the clinic walls, and recognizes that good outcomes are dependent upon concurrently addressing social drivers like food insecurity, housing insecurity, community violence, and a lack of meaningful economic opportunity. With that in mind, I'd like to provide an overview of one whole person-centered program that supports the mental health and social health needs of Kaiser Permanente members, Collaborative Care. Collaborative Care is an evidence-based care management program aimed at supporting members with mild to moderate depression and anxiety. The model allows for members to be effectively treated in primary care without a referral to specialty mental health. Collaborative care is unique in that it requires fewer mental health resources and nearly doubles the positive outcomes compared to treatment as usual in collaborative care. Collaborative care has also been shown to significantly reduce disparities in mental health outcomes between racial and ethnic groups. This is a model the whole country may benefit from. We are currently advocating the federal government to share best practices and funding for the implementation of a collaborative care model that prioritizes funding for health systems delivering care in underserved communities, expands coverage of collaborative care codes in state Medicaid programs, and eliminates the restrictions that prohibit state Medicaid programs from providing both physical health and mental health services to the same enrollee on the same day. Another important element of this social driver and mental health conversation is the ability to increase and train the mental health workforce of the future. With over 50 million Americans experiencing a mental health condition, we have only one mental health provider for every 350 individuals in the United States. Kaiser Permanente aims to increase the mental health and addiction care workforce by developing programs that shift the numbers, diversity, and language capabilities of the available mental health workforces to meet the needs of our communities. One example of a program supporting this aim is the Kaiser Permanente Health Workforce Accelerator Program, which we piloted in Colorado and Georgia in 2023. Through a strategic partnership, this program supports job placement, stipends, and the supervision of pre- and postmaster's associates who work in community provider settings serving vulnerable populations. I'll pivot now to review what we'll take away from today's event. Today's Policy Institute will examine the social drivers related to federal policies that are proven to promote mental health as it relates to housing, education, nutrition, and financial policies. Highlight Medicaid efforts to reimburse healthcare settings that provide consumers with connections to programs that meet their mental health and social needs. Review city, state, and federal program data that supports pertinent policy recommendations. Learn how these topics impact youth, racial and ethnic groups, and individuals with disabilities. And finally, discuss the global context and next steps for promoting mental health and recovery. I'll wrap up by noting how delighted I am that Kaiser Permanente is once again sponsoring Mental Health America's National Policy Institute. This is a wonderful opportunity to strengthen the connection between mental health outcomes and the social drivers that are having such a profound impact on the current mental health crisis. I hope that through today's rich conversation, we all gain valuable insight and feel collectively compelled to leverage the innovative ideas and resources discussed here today to improve the mental health and social needs for the communities we serve. Thank you, and I'll now turn it back over to Schroeder to kick off the 2024 Policy Institute.
Thank you again, Simon. What a wonderful voice you are for this work, and we are enormously grateful for your partnership and your support. We could not do this without you.